Welcome back to the C Morning Show, everyone. As we approach the halfway mark of our program today, it's time for our first discussion, and it happens to coincide with World Tuberculosis Day. TB is a disease that causes respiratory distress, such as chronic cough and shortness of breath. And Indonesia is committed to ending this disease by the year 2030.
And we have the data is for you. According to the Indonesian Health Ministry, there were 443,235 cases of tuberculosis in 2021 and 717,941 cases in the year 2022. The number had increased due to various factors, and some which are the negative stigma and discrimination among the patients.
Indeed, and to end these challenges, there's an organization called Stop TB Partnership, or STPI, that has a mission to enhance multi-sectoral collaboration between governments and society.
And we have here with us in the studio the manager herself, Thea Hutanamaon. Thank you very much for being here, Thea, and welcome.
Good morning.
It is
Hi.
World
Good morning.
Tuberculosis Day, by the way, today. And again, you were saying before that Indonesia has a mission to end it in 2023. Is it? 2030. Excuse me.
2030, yeah.
I was like 2023.
That would be
this
now.
year. Sorry about that. 2030. So it's about 7 more years to go. Yes. So how can we achieve that?
Yeah, so definitely it takes the whole of government, whole of society approach to NTB. It's a medical disease, but it requires lots of support from others, maybe from the society level, like being aware of the TB symptoms itself and to talk about TB to break the stigma. But also from the government itself, we don't only have the health sectors to be involved, but we need like the social sectors to protect people who are vulnerable so that they can have social safety net and be sure and be certain when they go into treatment, but also in terms of infrastructure to manage a better airflow and ventilation in housings, but also in the management of buildings. We also need support from the sectors in industries, because there are people who are affected by TB who are in their productive age group.
Right.
And the private sector then comes into play, right? They need to also take care of the workforce, who are the lifelines of the companies, the organizations, and our economies.
Yeah,
Okay,
I
so-
feel that too. Because my driver.
Yeah, exactly. You
Yeah,
mentioned
it's
that,
a
like 6
person-
months. That's a
Yeah,
long
to
time.
1 year. Now he's already undergo for 7 months now. And he said that I'm still
great.
going through it, and we'll give him the, the ability for him to just rest. and
Time to
whatnot.
heal.
Yeah.
So you mentioned stigma, both of you mentioned stigmas. What are some of these stigmas that we keep hearing about when it comes to tuberculosis?
Yeah, maybe when we talk about stigma, we also need to understand why it's there. Yeah, before we start to hear what it's said about. But stigma comes from the lack of understanding for any kinds of disease or people who live with the diseases. And stigma may also come from the perception in the society about unattractiveness.
Okay.
So when we talk about stigma, sometimes people stigmatize people with TB that they're very weak, that you cannot work, and the stigma is caused by the perceived standards of attractiveness or beauty, like you look so weak, you cannot work, and then because someone looks very unattractive when they get very weak.
Yeah.
But also the fear of catching the disease from the others.
Right.
Right.
Of course, yeah. That's very understandable. I think that's something that most people will feel about any infectious disease. But with TB, actually, lots of patients also experience that their utensils or like their rooms are separated from everyone else in the family. But actually, when you get into treatment, and if you go into treatment for 2 weeks, the risk of transmission would be decreased like very significantly
Okay.
Yeah.
After 2 weeks of treatment.
after 2 weeks of treatment.
Really?
And for most people, they will regain their health and they can actually go back to work. Yeah. So when they can come back to work, and if they wear like a face mask, that's actually you don't need to be separated from people with TB. They don't need any more isolation, especially in family contexts. Because when people are sick and if they have a chronic disease, because TB treatment takes like 6 months earliest, it could take up to 1 month. But if you have the resistant strains, it'll take up to 2 years. Could be up to 2
Wow.
years. Yeah. So in that case, can you imagine like if you're isolated for such a long period?
Yeah.
It could get you really depressed.
Yeah, of
right?
course.
So what people with TB needs is not to be isolated when they got TB, but it's actually they need love, they need support, because they need to continue this treatment, which relies on antibiotics. And if you stop taking antibiotics, then you may develop resistant forms of the disease,
Of course.
which would be even more dangerous, harder to treat, and even more
Right.
expensive.
So these antibiotics run for months and months at a time then.
Yes.
And if we learn anything, and you've gone through it, if you learn anything from COVID, being separated is no picnic. It's if we had to do 2 weeks at a time max
Right.
for COVID, can you imagine having to be separated for months at a time from your family?
Definitely. Just wanted to add to this before we go to your programs, Thea. I just wonder, how can you contract with TB, by the way? I mean, it is infectious, one. So do you get it because you're infected by someone else, or you can get it, within yourself because of, let's say, you go, with my driver, this is a personal experience because he likes to go home. So he commute from Jakarta to Sukabumi to his family during the weekend and whatnot. And sometimes he's using a motorcycle, so he got like those night
wind.
winds, when he drives home from Jakarta into Sukabumi. Is this also one of the, ways that you can attract TB?
So tuberculosis is caused by a bacteria. It's called Mycobacterium tuberculosis.
Yep.
It was found today, like in 24th of March, by Robert Koch. And so it's caused by bacteria. You cannot get it from night winds, but you get it because you are infected by someone who has an active symptoms like coughing, especially coughing, surrounding you. The thing is, Indonesia is endemic with tuberculosis. We have about almost 1 million, like 969,000 cases every year. And so you don't know whether you get infected during your commute, especially if you go with public transportation.
Or maybe because your body's just too tired. And
Yes.
that's the way you
Yes.
got it.
Yes, so tuberculosis bacteria is very smart. So you can have it in a latent condition. So for example, if you inhale the bacteria when you were like in high school, maybe, like for you guys like in high
It was
school.
a long time ago for me.
Yeah.
Then maybe the bacteria will be still remaining in your
dormant.
body, just dormant.
Really?
Yeah.
I didn't know. For
It
how
could stay
long?
for years.
Year. Okay, there you go. That's why it's important to stay healthy and keep that immune system up.
Keep yourself healthy, eat better, exercise, to maintain your immune system. So
Right.
if you're very tired,
Right.
then the immune system will go low, and then the bacteria will be awake.
Awaken the Kraken right
Yeah,
there.
there we go. Time for
my
me to
goodness.
wake. So what I think we've just shown is that how little we actually know about the details of TB. We do hear a lot of, wives' tales and, oh, you don't do this because you'll get TB. I remember my mom used to say things about TB to scare me when I was a kid. But apparently a lot of this is still inaccurate, to say the least. So how are your group's efforts so far in stopping this? We talk about reducing stigma. Part of it is informing people of the proper information. What is that like for you? What are some of the programs out there like for you to make the public generally more aware of tuberculosis, as well as reducing the stigma, and how challenging is it?
So in Stop TB Partnership Indonesia, we're a foundation established in 2018. And we work with government, private sector, and civil society and communities to talk about TB. So most of our programs are actually advocacy work. We do evidence-based advocacy. One of our biggest achievements was in pushing through for a presidential decree on tuberculosis. And in terms of stigma, one of the things that we did last year was actually a behavioral change campaign, because stigma can last throughout the patient pathway. Patient pathway means before you get sick, and then you get to the facility to get diagnosed, and then when you get into treatment until you're cured. So stigma persists throughout the patient pathway. And what we focused on was the stigma during the pre-visit to the facilities. Because people who are sick with TB, and if they don't get treated, they will infect others around them.
Right.
Yes.
One person can infect up to 10 until 15 people per year if they're not treated. So we wanted to support the government in enhancing the awareness of TB in the society. So we did a behavioral change campaign. It's called 14-1 Cek, because it was started during the COVID-19 pandemic, right? And COVID-19 also have very similar symptoms,
Seems like it.
like coughs especially. So we use 14 as a signifier, and it's actually a scientific signifier, and it's also in the rules of the government in their standards of care. So having 14 days of cough, there's only one solution: you should go check to the doctor.
All right.
Because it's so common for Indonesians to treat coughs, maybe using or any other medicine,
cough, yeah.
or like herbal medicine,
Yes.
or just not treat it because it's so common to cough.
Right.
But we're in an endemic country, so we have to take coughs very seriously.
Yeah.
So if you cough for 14 days and over, you should get to a facility where you can get checked.
Yes.
Used to hear that as a kid, right? Well, I think my family used to say 10 days. If it's over 10 days, gotta go to the doctor. And
Yeah.
get paranoid. Like in 10 days, I want to suppress my cough. So tell us a little bit more about how your organization works. Are there volunteers that help you out as well? What is it like with your collaboration with these other groups? Like what part of the obviously the part of the government is a bit more clear, but in regards to the private sector, how do you all work together to make this work?
Yeah, so we work together with the private sector through campaigns. So one of the pharmacies companies, they also support campaigns. But also, I think the biggest champion of tuberculosis is actually the communities, the civil societies. There are healthcare volunteers who are at the very forefront in the fight against tuberculosis, because they educate the people near them about TB and the symptoms. And we worked with another foundation. They're called Penabulu Foundation. We developed a community consortium. We work with, I think, around 9,000 cadres, so community health volunteers in 190 districts in 30 provinces. And I think we have to say thanks to these volunteers, because they always encounter or find people who have TB symptoms to ensure that these people who have TB symptoms can get into treatment.
Yeah.
So they help in checking if there's anyone coughing in their neighborhoods, and also referring them to the puskesmas, and also when they get into the puskesmas, to get them into treatment and to help to educate them, facilitate the communication between doctors and the communities, and accompany them throughout their treatment, so that you don't feel so isolated, right?
Yeah.
You know that someone
Yeah.
would still come for you
Yeah.
and support you until you're cured.
Right.
Yeah.
That must be a
That's
scary
also
thing as
scary.
well, right? If you have a cough for like a month, like you'd start to wonder yourself, like, am I going to be okay?
Right.
You're really worried.
And also, Thea, again, I'm worried to see the numbers because it's spiking up.
Yeah.
2021 to 2022, that's like more than 50%. What's your response to that? I mean, you already have your programs, volunteers are out there.
Despite
whatnot.
all these-
You've been, yes, educating the community and the people itself. Why do you think the numbers are still spiking up?
Actually, the number spiking up is a great thing, because it's estimated that 969 people have TB in Indonesia. It's an estimation number that public health people usually use. And the 700 people who are detected means that 74% of the estimated number, they can access healthcare. When they access healthcare, we prevent TB transmission. So that's actually a very good thing, because we can control TB. So we need to find more cases until it reach into the estimated number of almost 1 million cases.
Right.
Yeah.
Yeah, and I think it's the same thing with COVID, right? When people are so alarmed, like, oh no, positive cases going up.
Yeah.
Yeah, but more people are getting tested, and we're starting to figure out
Yes,
where they
right.
all are as
Exactly,
well,
yeah.
so it's easier to trace. So again, that is a good thing if you use it as a tool in order to help. Yeah.
And then before we end this, we just want to know from you also, Thea, how, if we have a family or maybe a colleague that is having this, you want to break the stigma. So how can we also help by breaking that stigma, especially if we know someone is having a tuberculosis?
Definitely first talk about it. Like talking is a very good way to break any kinds of stigma,
Yeah.
right? Like mental health or HIV, but also for tuberculosis. It's a very ancient disease, started in like Egyptian times, but the bacteria is just very smart.
Resilient.
Resilient.
Yeah.
It stays until today. So we should not forget about TB. We should talk about TB. That's one. But second is just to be understanding and empathic, you know. So just ensure that when you have coughs, don't take it easily, just get checked. And then if you are checked and you get into treatment, you can still be with us, and then we will support you. I think I saw from many TB patients and survivor stories, their biggest hurdle was stigma, discrimination, and lack of social support.
Right.
And that would be able to stop them from finishing up their treatment. So, and that's a very dangerous thing and a very painful thing.
Absolutely. And I think you're already contributing to that, Caroline, because I mean, by what happened to the driver that works for you is that he knows he has job security whenever he comes back, knowing that you reassured him to take the time to heal, get better, and once you're fully recovered, you can come back to work. That would be the biggest stigma for me. Like, hey, do I still have a job if it takes me a year to recover, right?
I'm praying for him to recover fast.
Because you need him.
You need him back.
He's a part of our family.
So, Thea, thank you so much for dropping by. And obviously, we're glad that you are able to take the time to commemorate World Tuberculosis Day with us as well. And we hope that this helps in getting the word out there and people to have more of these discussions.
Right.
Thank you so much for having me.
Great. Have a
you.
great morning. All right, we're going to take another break here on the program. But in case you joined us late, don't you worry, because we're going to recap some of our earlier stories from around the world when we return.